you have a wide range of internal rotation, you lack external rotation, at least in the way I did it, I hope everyone else does it in the same way, then that's a sign potentially of a high femoral torsion. And that can be associated with hip instability. The reverse, of course, lots of movement external, so that movement and less of that movement is a sign that you might have some femoral retrotorsion, which is associated with impingement. And then in addition, sorry, what I didn't mention is I'm having a look at his thigh-foot angle, seeing which way his foot points when I've got his knee flexed when he's on his front, and the angle it makes with his thigh. Now, if that's very high, it can be suggested that they have high tibial torsion. And that is important, although it's a rarer cause of hip issues. If you imagine somebody has pretty normal hips, normal hip, femoral rotation, but they have high tibial torsion, you might notice that when they're walking, their foot turns out a bit, and most people would probably be comfortable doing that. But when they are then, for example, doing a sport, or when they're running, most people can't run like that. So I don't know if people can see my feet, but they will turn their foot forward. And if you have tibial torsion, that movement can be quite significant, and therefore the functional effect of that can be to lead to your femur pointing backwards. So it gives you functional femoral retrotorsion, and that can be a cause of impingement. So very rarely, but occasionally, the solution to someone's hip pain is to derotate their tibia. I would not put that high up on your level of diagnoses. It really isn't that common, but it's understanding how the rotation of the limb plays into hip impingement and also hip instability problems is a very important part of the examination.